How are you doing? I'm Dr. Clayton Okpara, and I'm an internal medicine physician down here in the Houston area. I work primarily as a hospitalist. What is a hospitalist? Great first question. Well, a hospitalist is a primary doctor that you see at the hospital. They're there from the time of admission to the time of discharge, and most likely can take care of a lot of your issues, but sometimes they might need to bring another team member on board, like an orthopedic doctor who deals with surgery of the bone if there's a fracture or anything of that nature, a cardiologist who's a heart doctor, pulmonologist who's a lung doctor, nephrologist who's a kidney doctor, or any other specialty to help get you better, get you home, get you safe, okay? But what are we talking about today? We're gonna be talking about hypertension. Hypertension affects millions of people nationwide and is a very common issue that we deal with in the medical profession. Now, there's different stages to hypertension. The first one that we're going to talk about is normal. This is where you want to be medications or without medications. And that's with a systolic, which is your top number of 120 or below, or a diastolic, which is your bottom number in machine of 80 and below. Elevated or pre-hypertension is 120 to 129 with a 80 or below diastolic. Now, stage one, that is 130 to 139 systolic and a diastolic of 80 to 89. Now, stage two, that's where your blood pressure is 140 or higher systolic or greater than 90 diastolic. Now, what is systolic and what is diastolic? Systolic is basically the pressure from your heart contracting, pushing blood through your arteries. Diastolic is the pressure filling your heart before the contraction. Now, how do you check your blood pressure? The best way to check your blood pressure, and this is very important, is that you want to check on your left arm at heart level. I recommend the cuff that goes over your arm, over the brachial artery, but there are other devices that go over your wrists and fingers, but I always recommend the one that goes over your arm. You always want to check your blood pressure after about 10 to 15 minutes at a resting state. You do not want to check your blood pressure after an extraneous activity or a stressful event that's going to give you an inaccurate reading, okay? Now, there's different types of hypertension. There's primary, also called essential, and secondary. Let's talk about primary first. Primary is what we call idiopathic. 90% of causes are for hypertension. And it's idiopathic, which basically means that we do not have a true cause for why people have this outside of risk factors. Now, one of the risk factors is age. And as you can see on the diagram, as you get older, your blood pressure tends to go up. And the reason why is you get wear and tear, stiffening and calcification of your arteries, which will basically increase the pressure. Think of it as a water hose. If you squeeze on the hose, you'll notice that the flow coming out of the nozzle is a lot faster, a lot harder, and that's basically what's going on in your arteries. Now, what are the risk factors for primary hypertension? One is age. Now, we can't do anything about that unless you find the fountain of youth, and if you do, Nobel Prize, talk to me. But the ones that we can deal with is obesity, salt intake, and sedentary lifestyle. Obesity is basically where you're taking more calories than you actually expend. So you're always at a gain for your calories. That's going to lead to weight gain. Now, salt intake, whether you're applying a lot of salt to your food or eating a lot of food with a lot of salt content in it, can lead to elevated blood pressure. The other is sedentary lifestyle. That's basically someone who's not exercising and not moving around a lot. You're not expelling that calories. You're not expelling that energy. You're basically going from sit down to bed, bed to sit down. And that's something that can lead to high blood pressure over time. The other one that's not on here is smoking. Very important. Only way we treat smoking, talk to your primary doctor, is to quit. And there's different ways that we can do that, but that can lead to calcification because it causes damage to artery and it leads to that wear and tear over time. Now, secondary. This is the second type of hypertension. Secondary is about 10% of cases. 90% goes to primary and or also called essential. Secondary is a lot less common, okay? Most common is if you have a kidney issue with secondary. That's going to cause high blood pressure because your kidneys and heart work together like brothers and sisters. Your kidneys go down, the heart goes down. So if the kidneys have bad flow or there's a kidney issue, that can cause hypertension. The other one is a gland that sits on top of your kidneys called the adrenal. Now, if you have a tumor that is secreting an enzyme called aldosterone, that's going to cause your blood pressure to go up. Now, secondary is mainly we treat with medications, and I'll go over treatment for primary and secondary a little bit later, but secondary, we have to treat with medications. You can't treat with lifestyle modifications. Now, let's talk about hypertensive crisis. Now, this is basically when your blood pressure is ridiculously out of control. Majority of people who have this always go to the hospital. And the reason why is because this is the time that they have symptoms. And I'll talk about something called the silent killer a little bit later and why we call it that. Now, at this point, most people have symptoms, but what do we call hypertensive crisis? This is basically when your systolic is greater than 180 or your diastolic is greater than 120. And this is basically where your blood pressure is really high, where it can start causing issues to the rest of your organs. Now, if your blood pressure is just high and it hasn't affected your organs yet, we call that urgency. Now, when it starts affecting your organs, you start having chest pain or stroke-like symptoms, that's what we call emergent hypertensive crisis. For both of these, we normally treat with IV, and then we transition you over to oral, or what we call PO, which is tablet or capsule, antihypertensive medications or elevated blood pressure medications to help get your blood pressure better under control and then get you home to where you'll be well controlled with the blood pressure and not needing IV antihypertensive medications. Now, symptoms. So the reason why I call it silent killer is because most people with hypertension do not notice it. They have no symptoms at all. They normally don't have symptoms until the blood pressure gets to that point where they start having dizziness, lightheadedness, blurred vision, chest pain, stroke-like symptoms. When it gets to that point, that's when blood pressure starts to be a symptom. But most people don't feel those symptoms for primary or secondary till it gets to that point, or you check your blood pressure and then we notice that your blood pressure is really high and we have to further evaluate. Now, what I always recommend to people is that if you're on blood pressure medications, even though you don't have symptoms, please take your medication. That's a common thing that we always hear is that I feel fine, I don't want to take it. You're always going to feel fine unless it gets out of control. We recommend keeping it in control so we don't have to worry about it when it gets out of control. It's always better to be proactive. Now, treatment. So there's different treatments options for blood pressure. The first thing I like to talk about is lifestyle modifications, and this goes more for the pre-hypertensive or elevated blood pressure slide that I had before for the stages. These ones is dieting, exercising, and working on stress reduction. So, and also quit smoking if you're smoking, of course. So dieting is watching what you're eating, watching your salt intake, decrease the salt, decrease the amount of calories you're taking, or expend more calories by exercising more. Exercising, doing a little bit more than what you're already doing slowly. I don't want you to go out there and run an 8-mile marathon, but just slowly, 30 minutes a day, instead of watching a show, try to go out for a brisk walk. That'll do wonders for you in the long run. Stress reduction, this is very important. A lot of people are in a lot of stress, whether it's with the economy, COVID, family issues, job issues. Try to find a way to cope with that stress to get to a proper mental state, whether it's psychiatry, talking to somebody you can talk to in a deeper level about your stress, you can confine in, or yoga and meditations are other options you can do as well. I recommend this for any stage of hypertension, but this is what we recommend for pre-hypertension without having to add any additional medications. Now, we do recommend medications for secondary, and also we can get to stage 1 and stage 2. Some people can need 1, 2, and even 3 medications. We normally recommend starting these medications when you're at these stages to allow for the lifestyle modifications to kick in, and hopefully we can wean back on some of the medications, and less medications for you. We're happy. We don't like to keep pushing medications on patients. We just try to do the best we can until the lifestyle modifications can kick in and those can overtake the issues that are causing your blood pressure issues, and then hopefully we don't need as many medications, okay? There are a lot of different medications for blood pressure. There's medications that work well with your blood pressure and well with for your diabetes, protect your kidneys. There's ones that work well with your heart if you have heart failure, as well with your blood pressure, and your primary doctor will do a great job of picking the right blood pressure medication for you, okay? That's all that I have for now. I'm sorry I had to make it quick. I want to thank you for listening and staying with me on this topic. Stay healthy, stay safe, stay active, please.